and they've, been trying to prove Chinese medicine and acupuncture for a very long time. Western medicine has. And so it is now no longer questioned. There is 3 theories, but now are proven. All of these things mean something in Chinese medicine and speak to your overall health.
So Chinese medicine is very individualized, and we kind of wanted you guys to understand that it's a complete system where you're looking at each person, even though they may have some of the same things, and actually giving them a specific treatment to help their condition the most.
I'm going to introduce our 2 guest speakers now. So we have Dr. Heather Fulker and Dr. Jennifer Nelson. Let's start with Heather. Dr. Heather is a traditional Chinese medicine doctor and acupuncturist and stands at the forefront of holistic healthcare, blending ancient wisdom with modern science. Born with a passion for healing, Dr. Heather's mission is to ensure that the powerful benefits of traditional Chinese medicine are within reach for every client, enabling them to personally experience the transformative healing potentials it holds. In 2018, she graduated from the Canadian Institute for Traditional Chinese Medicine. This marked the beginning of a transformative career dedicated to improving the lives of countless individuals. Dr. Heather's mission has found its focal point in the realm of neurorehabilitation. Dr. Heather has not only treated individuals with neurological conditions, but also actively contributed to local research initiatives focused on application of acupuncture in stroke rehabilitation. These research contributions have illuminated new paths towards recovery and healing for stroke clients, not only in Alberta, but across Canada. While placing neurorehabilitation at the forefront of her practice, Dr. Heather also runs a general practice and relishes at the opportunity to impart age-old wisdom of traditional Chinese medicine to empower individuals of all backgrounds with the natural healing secrets it offers. Wonderful. Now, Dr. Jennifer Nelson started her career as a physical therapist assistant and worked both clinically and in the hospital as physical therapist assistants. While doing physical therapy, she discovered traditional Chinese medicine and acupuncture and decided to go back to school to learn about Chinese medicine. She graduated from the Alberta College of Acupuncture and Traditional Chinese Medicine in 2005 and began a private practice, initially treating sports injuries, working with the Canadian Olympic teams, as well as a professional and amateur athletes. She also mentored under a 27th generation Chinese medicine doctor and worked in his herbal medicine shop for many years, where she learned a wealth of knowledge. During this time, Jennifer discovered all the hormone imbalances that athletes have. She focused on women's health and took a variety of fertility, obstetric, and hormone balancing courses to assist her patients more effectively. About 10 years ago, Jennifer started treating brain and spinal cord injuries, becoming very interested in neurological acupuncture. She continued taking many specific types of neurology courses and acupuncture and learning from mentors both in China and Israel. For the last 10 years of her practice, Jennifer has been heavily involved with spinal cord injuries, concussions, traumatic brain injuries. I can only go so long before, and strokes for any type of neuropathy related diseases. So thank you very much, ladies, for agreeing to do this, and welcome.
Yeah, thank you.
I'm going to hand it over. Pardon me?
Thank you for having us.
You're very welcome.
Thanks, Linda. So I'll just share my screen here, and thanks for reading out those intros. Yeah, but yeah, we're both traditional Chinese medicine doctors and have like a focus in neurological conditions. And so neuropathies definitely comes up with this. Yeah, Jenn is a little more, she's been in the Chinese medicine realm a little bit longer than me. I'm probably newer on the game a little bit. And so can you guys see the presentation here?
Yes, we can.
Okay, awesome. So I've been studying Chinese medicine for the last 10 years, but licensed and practicing in the last kind of 5-ish, but have a long-standing history on the Western side. We both do. So I worked for around kind of 20-ish years in neurorehabilitation. So yeah, treating strokes and brain injuries. And so that naturally kind of led into now on the Eastern medicine side of things, treating, neurological conditions and neuropathies being one of them. So we're super excited to be here and to chat with you guys about this phenomenal medicine and how it can help with neuropathy. So we'll get into it. So in this presentation today, so we're going to first talk about what is Chinese medicine and a little bit of the history about it, because it is a little bit like, it might be new to you. You might have heard of it before, but just kind of explaining some of the theories behind it. We're also going to talk about what is a Chinese medicine practitioner and some of the education needed to be able to practice. Also the types, this is where Jenn is going to talk a little bit. We're going to talk about the types of neuropathy and how acupuncture and Chinese medicine can help with it. And then we'll finish up the presentation with what to expect from an acupuncture and Chinese medicine treatment. And then we'll save a bit of time at the end for any questions anybody might have. But then also feel free to jump in on that chat box if we're kind of chatting about something and there's a question that comes up. And then, somebody will kind of let us know that there's a question and we'll do our best to address it. Okay. So first up, what is Chinese medicine? So prepare to be kung fu wowed by this beautiful, natural, and holistic medicine. So in the heart of Chinese medicine extravaganza, we're going to take a trip through the theories that the one and only Mother Nature made herself. And in this medicine, she is at center stage. So Chinese medicine is like ancient wisdom looked at the world and said, hey, let's observe how this beautiful nature thing works and apply it to humans. Then enter the yin and yang, the cosmic odd couple, keeping everything in balance, including your own individual healthy ecosystem. Okay, so all kidding aside here. So Chinese medicine is really it's based off of observation and off of observation of nature. So it's considered to be its own complete medical model and complete medical system. And it uses the perceived laws of nature and applies them to our health. And so if these rules and these laws are out of balance in any way, this is when disharmony and disease can appear in our health. A little bit of history about Chinese medicine. The Chinese medicine it's been around for thousands of years, long before Western medicine as we know it today. Chinese medicine is over 5,000 years old. And again, it's based on observation of nature. But how Chinese medicine was first introduced to the Western culture was back in 1971. And so Jenn and I were actually talking about this last night, and I actually had to go back and fact check this a little bit, because I thought the story went that, well, here's the story. So President Nixon traveled to China, and in his entourage, he had the New York Times journalist James Reston with him. While they were there, James had some stabbing pain. He was taken to the hospital, and it was diagnosed of acute appendicitis, and he needed to have an appendectomy. Now, when I was putting this together, I actually thought the story was that the appendectomy was performed by acupuncture. But when I actually went back and looked, because that does happen, there are surgeries that are performed with the anesthetic, acupuncture being the anesthetic to help to perform the surgery. It happens more so, I would say, probably in C-sections in China versus like actual surgeries. But this particular surgery, there was anesthetic. But what happened afterwards was James was having trouble, which is common, with pain post-surgery, and I was having a lot of gas-related pain from the appendectomy. And so there was an acupuncturist brought into the hospital, and yeah, 3 needles were put in. And this was James and President Nixon's first introduction to acupuncture and the benefits of Chinese medicine. So obviously he got better. He traveled back to New York and to the States, and this is where he wrote about it in the New York Times, and this is how America was first introduced to acupuncture and Chinese medicine. So it's really not that old, actually. Yeah, and this kind of, I feel like, validates some of the history of Chinese medicine, because, you know, in school, we learn about it, you know, being an ancient form, and it's over 5,000 years old. But this is actually the story of Otzi, I feel like, kind of proves this a little bit. So in 1991, up in the Otzi Alps, hence Otzi, there was a body found. And so in the Otzi Alps, in the ravine, and how the wind was blowing over the Alps completely mummified this body. And so modern day forensics were able to really like dive into what was happening with this person and really get a good history about this person. And what they found on this person, because his body had mummified, was that Otzi had several acupuncture points tattooed on his body. And when they looked at, you know, like kind of what these points might be used for, they were able to find that these points were for low back pain and digestive issues. And through the forensic science, they were able to determine that this particular individual suffered from these conditions. And so, yeah, I think it kind of validates some of the history that this has been used for thousands and thousands of years. So, yeah. Now, I want to talk a little bit about Western medicine, which we kind of know in today's medicine, versus Chinese medicine, and some of these differences a little bit. So Western medicine is very much derived from an evidence-based model and a science-based model. And we kind of look at things from Western medicine in compartments, right? We'll look at things from like a musculoskeletal point of view, or maybe a cardiovascular point of view, or a neurological point of view. Whereas Chinese medicine, their medical model is a little bit different. The medical model in Chinese medicine is more around the balance of an ecosystem, and everything plays a role together, and everything kind of relies on one another. And it's a very holistic and natural approach. I find myself in clinic telling people, you know, when people ask, okay, so when should I see a Western medicine doctor and when should I see a Chinese medicine doctor? I often find myself saying, well, you know, if I'm having a heart attack or I've broken a bone or there's something very acute and an emergency situation, don't take me to a Chinese medicine doctor. Definitely take me to an ER. We're very fortunate and very lucky to have the medical advances that we do. And that's where I want to be for those particular situations. But if I'm suffering from something that's kind of like crept up on me over time, you know, like maybe some sleep issues, maybe some neuropathy where it's, you know, I've got some numbness and tingling that's kind of progressively kind of getting worse, or maybe I've got some digestive issues that's sort of kind of, you know, cumulatively getting worse. That's definitely when I want to see a Chinese medicine doctor, because Chinese medicine really kind of looks at the whole body and really gets to the root of things versus just kind of treating like acutely and what's like emergent at the point. I hope that kind of gives you kind of an umbrella there of what Chinese medicine looks like. So for a long-standing time, you know, it's been questioned, well, does this, you know, what's actually working here? And they've, you know, been trying to prove Chinese medicine and acupuncture for a very long time. Western medicine has. And so it is now no longer questioned. There is 3 theories, but now are proven scientifically. So some ways that acupuncture works, well, it's proven now to release endorphins, which are the body's natural painkiller. Also, something else that this is new in the last kind of like 10 years, the channels and meridians used in Chinese medicine and used in acupuncture have now been proven microscopically. So they have now actually found the structures and found these channels microscopically, which is pretty cool too. Another way that acupuncture has been proven scientifically is it interrupts pain signals sent to the nervous system. So yeah, that's another way. So an important piece I want
to really quick,
yeah, sure.
question about differentiating what the education is for Chinese medicine doctors. So people were curious how you know if you're a doctor of acupuncture, a regular medical doctor, or who has what training. So I think this will answer it there, but I just wanted to address that question.
Beautiful. Yeah, this is perfect timing for this because we're going to get into this right here. So because there's lots of practitioners now who incorporate acupuncture into their practice via IMS and dry needling. So you see this lots now with physiotherapists, naturopaths, and chiropractors. They're incorporating this in. So I want to talk about the differences here. So when you see an acupuncturist and who's coming from like a Chinese medicine background, they have studied a minimum of 3 years, usually 4 years. And this is studying Chinese medicine and the background with it. But they also have quite a bit of Western medicine behind them. They have 420 hours of Western medicine behind them as well. Also, another one, which is huge, I can attest to this because Jen and I have both done this, but this is a lot of hours where we spend in supervised student clinics. So 1,320 hours of supervised clinical treatments before you can even go and write your exams to become an acupuncturist and Chinese medicine doctor. Another thing is we have 2 national board exams, so that goes across Canada. And in Alberta specifically, we have 2 practical exams. This doesn't happen anywhere else in the country, only in Alberta. We have 2 Alberta practical exams as well as a safety and jurisprudence. So this is a little bit different than the acupuncture that you're getting from a physiotherapist or a naturopath and a chiropractor. This is different because what they do with that is they take the base knowledge from a Western medicine model and they utilize their already foundational knowledge of anatomy and physiology from a Western medicine perspective. And they teach them some kind of local meaning at the site where there's an issue, some acupuncture points. They typically use like a thicker and a longer gauge needle because, again, utilizing their knowledge of motor points, because each muscle has a motor point, they will fish and find that motor point to relax the muscle. Now, both of these forms are very, very, very useful tool, and acupuncturists will use this IMS and dry needling as well. But they're 2 complete different kind of ways to approach things. So when you're getting it from a physiotherapist and a naturopath or a chiropractor, it's coming from a Western medicine model, whereas typically from an acupuncturist, it's coming from a more Chinese medicine. And I always encourage people to kind of find out and ask those questions because it's really important that you understand and kind of, the basis and the foundation for your treatment and how that person's approaching it. Another thing I just wanted to add in here too. So when you are getting it from a physiotherapist or a naturopath chiropractor, they take a couple weekend courses and can practice on someone within a couple weekends. So just to kind of put that out there too. So yeah, is there any further questions about that? Does that kind of help, I hope?
Yeah, I think you're good.
Okay. So here's another piece that kind of sets Chinese medicine apart a little bit. So one thing that probably the Chinese medicine practitioner is going to ask you, they're going to want to look at your tongue, which is something that a physiotherapist is probably not going to want to look at. Now, why do we want to look at people's tongues? Well, the tongue is a complete system and a complete picture of our whole health and our whole kind of body's ecosystem. So from a Chinese medicine standpoint, this is really important for us, and we really want to see what's going on. Now, there is a bunch of things that we are looking at when we look at your tongue. We're going to look at the body of the tongue. So we want to look at the shape of the tongue, how big it is. We want to look at maybe does it quiver? Does it have a bit of a wave in it? We want to look if it's deviated to one side of your mouth. Yeah, is it swollen? Are there teeth marks on it? We also even look at the cracks of the tongue. All of these things mean something in Chinese medicine and speak to your overall health. Even the differences between if those cracks are horizontal or if they're vertical. These are all important pieces. Another thing, we're going to look at the color of your tongue. So as you can see in some of these pictures here, so there's varying colors. And have a peek at your own tongue if you want after this, and you'll see some of the differences. Look at some other tongues. And even the coating. The coating is important to us, And in some of the bottom pictures, you can see some of the differences in the coating there. So is it yellow? Is it like a greasy, thick? Is it a white coating? Is there no coating? All of these things mean something in your health and what's going on for you. So another thing I want to talk about here is some of the modalities that a Chinese medicine practitioner can use. Now, I think the most widely known is probably acupuncture. That's probably most of us, it's probably our go-to move. And I think variably because it works very well. So it's probably our go-to move for most of us. But Chinese medicine, because it is a complete medical system, there is a bunch of things that we have in our toolkit that is not as well known. So herbal medicine is a big one that we use, and especially in neuropathies, herbal medicine is a huge one. So we have tailored kind of herbal formulas that we use to treat various conditions. Nutrition and dietary advice, depending on the person's pattern and their Chinese medicine diagnosis, will give kind of tailored dietary advice to help that person. Tuina massage. So Tuina massage is a form of massage that's applied to acupressure points, and it uses techniques to help that person's condition. Cupping, so there's a picture of cupping there. You may have heard about that. So cupping is another modality that we use in Chinese medicine. Gua sha, or some people have heard of Graston. This is a scraping of the skin. This is another modality that is used in Chinese medicine. Moxibustion, which is the burning of a herb. This is a common one too. Moxa, or sometimes referred to as mugwort, and it's the burning of a herb. We'll also give maybe some exercise tips for Tai Chi, Qigong that can benefit your overall health and contribute to the better of your condition. Lifestyle modifications, that might be something that we kind of bring up or suggest. And another thing that is used quite often in practice too is ear pellets and ear seeds. Now these are they're pellets and seeds that we apply topically to a person's ear, and they apply. So they're utilizing acupressure points to really treat the condition, and this is something typically that the patient leaves with, and we usually leave the ear seeds on typically kind of 5 to 7 days. So this is another way that we might treat things. So it's not just acupuncture. So if anyone is a little nervous about needles, because lots of people are, make sure to kind of chat with your practitioner about some of these other options, and is there other ways that we can look at things. Yeah. Okay, so this is where Dr. Jenn's going to pop in here, and she's going to kind of take the steering wheel from here.
Yeah, so I'm going to explain a little bit more about kind of what we look at in Chinese medicine. So in Western medicine, these are just general symptoms of neuropathy, which I'm sure you guys can all read through, and many people are very familiar with what their symptoms are. But the reason we bring up this slide is that what your symptoms are, or what type of pain you are, we ask a lot of questions on your first treatment in Chinese medicine. So we're interested if you have either a burning pain or a dull pain. So if you can describe what your symptoms are and explain to us that you're having problems with your bladder, you're having these kind of issues, it tells us what kind of diagnosis you have specifically to your condition compared to somebody else with the exact same diagnosis, and how we can specifically hone in and pick the correct acupuncture points or herbal formulas, and we can give you the best treatment possible. So we ask lots of questions. So knowing what your symptoms are and kind of recognizing them is important. And then I'll get you, Heather, to switch to the next slide there. And then neuropathy in Chinese medicine. So there are over 100 different types of actual neuropathy in Western medicine. So some people have peripheral neuropathy, some people have foot drop. Like there's a whole bunch of different kinds of neuropathy in Western medicine. But Eastern medicine looks more at the pattern that you have, which is how we diagnose and treat that neuropathy correctly. So for example, like if me and Heather both had a foot drop here and we both presented with that, one of us might have the pattern in Chinese medicine, which we would call blood stasis, which would mean that your tongue in that condition would look quite purple, and it would be quite a reddy purple color. You could have stabbing pain and some tingling. Where Heather, if she had foot drop, even though it's the same problem, and again, Western medicine strictly would look at this as a peroneal nerve issue, and they would possibly look at your tibialis anterior not working well. But in Chinese medicine, we look at her pattern. So if Heather has very poor digestion, and she's having some digestive problems, her diagnosis and pattern after looking at her tongue, she might have a pale swollen tongue with some tooth marks. We might diagnose her with something we would call a spleen yang deficiency in Chinese medicine, and we would pick different points to treat her, even though we have the same condition, and probably different herbal formulas, and actually get a better result than if we just needled the same spots for every patient who had that condition. So Chinese medicine is very individualized, and we kind of wanted you guys to understand that it's a complete system where you're looking at each person, even though they may have some of the same things, and actually giving them a specific treatment to help their condition the most. And this we find more effective even when they're doing research studies. They'll do something that in a research study called sham acupuncture, where they nail everybody at the same points. And then they'll do the Chinese medicine acupuncture as the other study against the sham points, and with the actual Chinese diagnosis. And the Chinese medicine diagnosis usually wins every time, where when you're treating specific to the patient, we get better results. And Heather, I'll let you switch that there. So what types of neuropathy does acupuncture and TCM treat? So there again.
Can I throw in a question?
Yeah.
Sorry, we had one from Ron. And he said he went to one many years ago, an acupuncturist, and after many treatments he felt like he didn't get any better. They were also treating digestion and back pain and didn't get any better. Have things improved over the last 20 years? And if so, why?
I think a lot of it depends actually on the individual practitioner, of what their training and background is and kind of what they were treating. There has been a lot more research and studies on things in neuropathy in the last few years, especially me and Heather being in the neurology field. There's been a lot more people focusing and concentrating on protocols and what works the best. But I've always had really good success with neuropathies. Heather, do you have anything you want to add to that?
Yeah, I do. I always try and encourage people, don't be afraid to even do a bit of an interview with the practitioner. And they, you should have an opportunity to ask questions. And so don't be afraid to ask, have you treated neuropathy before? What are some of the outcomes that you've seen? Don't be afraid to kind of pose those questions. And what are my treatments going to look like? How many do you expect? These are, you're paying for these treatments. And so you should very much have the opportunity to ask these questions. And so feel free, and if the practitioner is not open to that, well, maybe that's not the best fit too, I will say, just like physiotherapy, just like even naturopath, chiropractors, we all enter into practice as a general practitioner. So you can treat anything out there. You have the education and background to treat anything out there. But from there, most of us kind of go on and kind of specialize in different areas. So like Jenn and I, for instance, so we're more in the neurological field. But lots of acupuncturists will get into more fertility or more cosmetic acupuncture, things like that. And the same goes for physiotherapists or naturopaths. Some physios will kind of get into more maybe pediatrics, or maybe they'll get into more sports injuries, things like that. So I think it's really important to kind of like, if this is of interest and you are looking at like, thinking about using Chinese medicine, don't be afraid to ask that practitioner. They should welcome those questions, really.
So I've tried doing that, over the phone before I even get into an appointment, right? But, when you're speaking with, say, the receptionist, and they quite often will just say, oh yeah, they've done that. Is there anywhere where you can look a practitioner or all practitioners up and see what sort of specialties that they have?
I think most websites have a little bit of a bio on that person, but also I think most clinics offer too. They will offer like a free, like you can book in with that practitioner for like a free 15-minute kind of phone call. I know I do this, and I think Jen, you do this too, right?
Sure.
Yeah. So if anyone does have questions, they can book in this free consultation, and we can kind of have a little bit of chat about their situation and what's going on, and they can get like a little meet and greet and kind of decide from there. Yeah. Yeah.
And we'll go over, I'm going to talk in a little bit here about what to expect from acupuncture and how fast it should work and stuff like that. But depending on what kind of neuropathy it is, some is more stubborn than others. But definitely, I think one of the most rewarding things about neuropathy is that you often can see results like right away, which is a really nice thing with that. But certain things that have been there for longer take a few more treatments. But usually your practitioner will kind of outline what you're expecting. And if it's not what you're expecting, be honest with you and be like, maybe we need to steer you to a different practitioner in a different direction.
Jen, we have another interesting question about what types of neuropathy does acupuncture and TCM treat? So does it work for mobility, balance, and strength issues resulting from peripheral neuropathy?
Yes. So again, Heather and I kind of have done a lot of extra work and schooling in the neurology side of things. So for example, if somebody has had a stroke, their balance is quite often affected, and they have more than one issue going on. But by needling the areas over the cranial nerve, so on the scalp, doing a specific kind of neuroscalp acupuncture, which is a specialized system, you can activate that their balance starts to come back and improve. And you can work on the whole kind of body with neuropathy and trying to reconnect the brain with the distal nervous system and kind of get the peripheral nervous system to talk to the central nervous system. So the two, when they talk together, there's usually a disconnect somewhere and you're hooking them back up.
Yeah, and if I could add to that as well, I would say because it's, this Chinese medicine is a different approach, right? Like, so we can have like, 3-4 people come in with like balance issues, and each one of them is treated very differently because it comes back to their specific kind of individual health and their individual kind of Chinese medicine pattern and what's presenting in their ecosystem. And so we're putting that system back in that balance, the ecosystem balance, but that has an overall effect in kind of whatever kind of the symptoms they are presenting with, if that makes sense. I hope that helps clarify things a little bit.
Yeah.
Yeah.
So for this slide, what we were talking about is just the stuff that neuropathy and acupuncture and TCM help to treat. So there's all different kinds of neuropathy. And these are just some general kind of vague examples like post-surgery neuropathy, diabetes or infection, and that infection could be from long COVID, it could be from HIV, it could be from a number of different reasons. Side effects of medications, drugs, or even chemotherapy. Neurological neuropathy, some people have brain tumors or something going on in brain or spinal cord going on that causes their neuropathy. Idiopathic neuropathy means that we don't know why it happens. So in both Western medicine, you go to your medical doctor, they have no idea why it's happening, but it's occurring. And some of these I actually really enjoy treating because sometimes when you do the Chinese diagnosis, you find a number of different patterns that are happening in the body. When you treat those, the neuropathy gets better. Poor diet, alcohol overuse, or even toxins in the body can cause neuropathy. Kidney disease is a common one. Inflammatory disease related to neuropathy. So diabetes is a huge example of a big one that we see in clinic, and traumatic injury that damages the nerves. And then Chinese patterns associated with neuropathies. So this is where it gets a little confusing to people who aren't Chinese medicine doctors. So the patterns that we name have funny names with like qi and wind and yin and yang, which are all really confusing terms if you're not studied Chinese medicine for a long time. But those names don't necessarily have to do with the function of the organ. So if we say you have a kidney yin deficiency, it does not mean you need to go to your medical doctor and test your creatinine. There's nothing wrong with your actual kidney. It could be the function of your kidney, but more often it's the energetic of that organ that we're talking about, and how it plays a role in your body's unique ecosystem. And so what that means when we say you have a kidney yin deficiency is that there's a set of symptoms that would occur. So it's like a list of symptoms that we check off. And if you have so many of them, then you're diagnosed with that in Chinese medicine. And there's a set of points and a set of herbal stuff, and there's a set way to treat it. So it's a funny names, which sometimes I don't even get into because it confuses people with the names of the pattern. But the important thing is your Chinese medicine practitioner knows those patterns, and when they associate them, they can treat that condition really well. So I'll give you guys some examples. So common ones for neuropathy, the name of it would be qi and blood stagnation. And you could see that in something like a spinal cord injury or after a surgery. Lung wind invasion. So again, it has to do with environment. When you hear that somebody has a wind cold or wind heat infection, it often has to do with a virus. Viral stuff like long COVID, Bell's palsy, HIV, those are examples. If you have a kidney yang or a yin deficiency at the same time, typically you might see this in an older person, usually in their lower extremity, but not necessarily there. Often they'll have no hair on their legs because they have such bad kind of circulation going on, and you'll see those reddish purple veins and kind of discoloration in their legs. Liver and kidney yin deficiency with yang rising. A good example of this is a perimenopausal woman. You'll quite often see somebody who's having hot flashes. They might be quite irritable. Sometimes this person, like if you look at their tongue, it will match up. So there's a whole set of things the Chinese medicine doctor's looking for. And a tongue like that would be quite red because they're having that heat from the hot flashes kind of come up to their head. Excess exhaustion and depletion would be related to kidney disease or even chemotherapy. If you've ever seen somebody who's had chemotherapy, they're often quite tired and they look a little depleted and low energy. And then lastly, spleen and kidney yang deficiency. So this is the most common one you see in diabetic neuropathy. But there's often more than one pattern going on, and the Chinese medicine doctor, that's what they're trying to do, is figure out kind of what your unique diagnosis is, no matter what kind of neuropathy you have, and then give you the correct treatment and follow through with that to give you a good result.
So we have another question. Perhaps you could address this at the end. Is there a directory for clinics and or doctors in the US?
We will address that at the end, but yes,
Okay.
State by state, it's a little different, but we'll get to that at the end for sure.
And then another question, GBS is fairly quick onset. Is this conducive to Chinese medicine?
I've treated lots of people with GBS before. Again, it's a neurological condition, and again, the sooner you get at it, the better with Chinese medicine and that kind of thing, because it is a quick moving kind of fast onset condition. But again, there are specific patterns that we diagnose, and we try and treat it as soon as we can.
And I'm guessing the answer to this very good question is yes. Do you recommend particular diets for particular problems?
Yes, absolutely. So in Chinese medicine, we study nutrition, and we kind of, again, look at both the Western and Eastern system together sometimes. So sometimes it's vitamin recommendations, and sometimes it's specific Chinese medicine. Like we go back to that pattern, and with your pattern, there's specific things. So at the last slide, we're going to give some examples of that, and we'll go over that a little bit here.
Thank you.
Yeah. Okay, if there's no other questions, then we'll move forward. So this is just an example of the pain diagnostics in Chinese medicine. So like I said before, when you come for your first appointment, we ask lots of questions. So We are looking at your tongue, we're observing you, we're taking your pulse, we are checking things out in a different way than maybe your medical doctor. But for us, the questioning is really important because we want to know about what type of pain you have, because by answering that question, we are able to pick the correct points in order to give you a better result. So we'll give you a couple of different kinds of pain. So sharp stabbing pain in Chinese medicine, that's often associated with the qi and blood stasis pattern. Person often would have a purple tongue. You know, we matched up with a whole bunch of things. Their pulse would look a certain way. They might have a whole bunch of other symptoms that we would go into. And sometimes it feels worse with touch, not always, but sometimes. The second kind of pain that we ask people about is they have any dull, achy pain. This indicates qi deficiency. In Chinese medicine, that's the name of the pattern. And again, usually it feels better if you're supporting or holding the area. And again, there's usually a whole other set of symptoms that we kind of associate with that. Some people get the pressure as one of the types of pain they have. And again, immediately we put a pattern to that pain. So if you have pressure, we would think that there's some sort of dampness in Chinese medicine. And again, there's specific diet stuff, specific herbs, and specific acupuncture for that in particular. And then burning pain. Burning pain in Chinese medicine always indicates that you have heat somewhere in your body that that isn't working well for you. That heat can be excess or deficient heat, which is just, again, the way we Chinese medicine people kind of diagnose what's happening and kind of figure out how to fix it. So if it's excess heat, it might be like an infection. So if you guys think of having like a raging sore throat, it's usually pretty red, and you know, we associate that heat in your body with infection. And if you have a deficiency heat, often things like hot flashes in Chinese medicine are actually coming from a heat because you have a deficiency somewhere in your body. All right, how does acupuncture work for neuropathy? So we have several tools in our little toolbox that we use for acupuncture specifically. Neurological acupuncture is one of the key things that both me and Heather like to use. And so it's a specific training of scalp acupuncture. Me and Heather have done some teaching to some of the acupuncturists in our association on a little background on how to use neurological acupuncture for things like peripheral neuropathy. And it's a specific system using the scalp, and you're able to, by needling on the scalp, reach the cranial nerves that come up through there and create circulation to certain parts of the brain to, again, reconnect your central nervous system to your peripheral nervous system again, so they can start talking together. So I have like fun little teaching models that I sometimes use, like this little guy that have points all over your head. But it's very important that you needle over the correct part of the scalp to reach the correct part of the brain, so you can kind of get blood flow going and rehook things up. We use a combination of both distal and proximal acupuncture points. That means that points that are far away from where your neuropathy is. So you could have pain, you could have pressure. So some points, like if you have a problem in your foot, we might be needling near your wrist or your elbow or your shoulder, somewhere quite far away from where your problem is. And then other times we're going to needle proximal points, which are exactly where your pain is, so right on your foot.
Is that something you would do when you have like referred pain? I know sometimes I'll touch somewhere, say on my back, but I'll feel it down my leg, say.
Yeah, so again, with that, we might treat the back and the leg both, or we might treat the brain and the back, or like we'll kind of, it's kind of from Chinese medicine point of view, look at what pattern you have and then decide which point systems we're going to use to kind of address that most effectively. And
if I can kind of jump in there too, I would say in terms of like referred pain, acupuncture is a great tool because often, and this is a big difference between Western medicine practitioners and Chinese medicine doctors, often, you know, when we've got like referred pain, you know, we won't even put needles in the area at all. We'll be talking to that nervous system via somewhere else on the body. And so when it comes to referred pain, we'll be talking to a different area, so it'll clear up that referred pain versus, like, let's say the referred pain is coming from your back, but you're getting it in your foot, right? So we might use points on your hand, so not even touch your back or your foot to treat that pain. And whereas probably typically you know, if there's a Western medicine professional doing the acupuncture, they're probably going to do something more local on your foot. Yeah. Does that help? Does that make sense?
Mhm.
Yeah. Okay.
Okay, and then we always give patients homework. If we Chinese medicine doctors like to give you something to go home with and do usually. So patients following their homework of basic things to improve their neuropathy really improves their results. So if we're kind of explaining that you need to change certain things in your diet or take certain vitamins or massage in certain places, but usually we look at what's happening with you and we give you a little bit of homework. Sometimes it's herbal medicine, but it can be different areas of homework. All right,
Do you want me to talk about this, Jen, or you want to?
Yeah, I'll let Heather read about the study that we posted here for Chinese medicine and neuropathy.
Yeah. So we thought it was kind of important, right? We got to add in some science here and some of the validity. But when you open up some of the research behind some of this, it's huge. It is very extensive. And plus, like, it's really hard to kind of narrow down, I would say, the different kinds of neuropathy and the different styles of acupuncture. Jen kind of mentioned a little bit about sham acupuncture, and just like kind of like there's a ton of studies. So when I'm looking at the research, I like to look at more like a meta-analysis. So meta-analysis, just as the refresher here, so it covers like a bunch of research studies, all targeting kind of like one kind of like like common kind of areas here. So in this particular meta-analysis, so this is this one looked at diabetic neuropathic pain. And this one was 19 studies involving 1,276 patients. And so looking at these 19 studies, they were able to come to the conclusion that, yeah, acupuncture therapy significantly improved the clinical efficacy of pain intensity and pain changes. When we talk about pain changes, that might mean like the nature of the pain. So maybe it's, you know, changed from like a sharp stabbing into more like a dull ache, or it's like changed like the quality of that pain. And then, yeah, so it changed in diabetic neuropathic pain. So yeah, I think that's a pretty great result there across the board. Yeah.
Heather, before we go further, and maybe you can address this at the end, what is the charge for an initial appointment? A consult, I guess. What is the fee?
Yeah, we can. So I know Jen's going to get into what the treatments kind of look like here,
Okay.
but I can talk a little bit about that here now before we get started. Often, most practitioners charge a little bit more of an initial fee. So if you've, you know, maybe done the interview with the person and you're like, okay, I want to proceed with this, and you're going to book an initial, the person, most practitioners have an initial fee. I know, Jen, you do too. And it's because the initial kind of meet and greet with the practitioner, you can kind of see it's quite extensive. We need to know your whole body ecosystem. So it's usually a little bit longer than the actual kind of treatment, because we need to kind of get to the root of what's going on with your own health and your own ecosystem. So there's usually a little bit more of a fee. Usually those range between, like, I would say like 115 to 135. I have seen other practitioners go a little bit higher than that, but that's probably the range you want to pay. And then follow-ups typically kind of range anywhere between like the 75 to like 120 mark. Yeah.
Okay, and then the second question is, can acupuncture be used to treat bipolar disorder and CMTA, both issues?
Yeah, and because Chinese medicine and acupuncture, again, is sort of that whole complete medical model. So we definitely see like mental health conditions come in. We definitely see like, yeah, a wide range of conditions and people looking for a more natural approach. You know, they don't want to kind of keep taking pharmaceuticals the rest of their life. They're looking for something more natural. Now, with that being said, I do want to kind of put the caveat in there. we as practitioners are never, approaching their condition by saying, stop taking your drugs. If anything, it's the opposite. Chinese medicine is a conjunctive therapy. And so we want to work with kind of what you're already doing and just hopefully kind of help you along the path. We're never going against any Western medical advice. And if anything, we're hoping to work with those practitioners as well. And as like a collective.
Yeah, exactly. I find that sometimes with those kind of things, people are on medication already from their medical doctor. So we ask them to continue that. And then we try and treat everything around it. So if the CMTA is the biggest thing that's untreated, or if they're having sleep problems, despite being on medication, like we kind of look at, again, that questioning, and we figure out what their symptoms are and where Chinese medicine can come in and help whatever the Western medicine has already started to help with on their front. And we try and work together.
Okay, thank you.
So can I just clarify with the CMTA? I have CMTB, but obviously it's not going to be any kind of cure or anything. But like Heather mentioned in the beginning, if it releases endorphins and all those other reasons that she gave that it can help, it's going to basically relieve symptoms. And that's about it, as much as it can do. CMTA, all CMTs are permanent damage.
Yeah, so we can't cure it, but often we can get the symptoms to be much different or better or more manageable. And sometimes what we can get things to do is that we can actually get it so good for a while where people feel like they're actually in remission from their symptoms for a bit, but it can come back depending on stress and different things. But with the CMT stuff, it is there is not a cure for it. You're absolutely correct, but we can symptom manage pretty well. If there's no other questions, we'll finish up here. We are almost done, guys. So this is just about what to expect actually in a typical acupuncture and TCM treatment. So we've already kind of gone over this a little bit. I think questioning whoever is treating it and kind of seeing what their background in treatment is. Again, lots of physios, chiros, medical doctors, naturopaths have some acupuncture experience. And then the traditional Chinese medicine doctors have the more extensive training in looking at the whole body, hormones, organs, how everything else is working. And we kind of have some tricks of treating things, again, in different ways from parts of the body that are far away from where some of the issues are. So the length of time, the initial assessment, because we ask a lot of questions and we do a lot of exams on your tongue and your pulse and different things, you can expect anywhere from 60 to 90 minutes. And then that includes a treatment. So we do questioning and a treatment, usually all in one. And then the follow-up treatments are usually between 30 to 60 minutes, depending on what your condition is. Frequency, it has a lot to do with what the client goals are and consideration of whether it's acute or a chronic stage of neuropathy. And again, just like we just mentioned, some things we aren't going to be able to completely cure, but we are going to be able to get some symptoms gone or make a huge improvement. Post-treatment, fatigue is actually a really common symptom, especially if we are doing that scalp neurological acupuncture. Because if we are kind of working from the brain end and we're asking your brain to repair a nerve or start to reconnect something that has not been talking well to each other, it makes us quite tired. Just like in a concussion, if your brain is going to be healing something, it kind of wants to shut you down and make you tired so it can do some fixing. So people are often quite tired if we are doing scalp acupuncture the day of the treatment or right after for a while. But that is a good sign that it's working, that your body's actually trying to do something for you. And then how many treatments? Well, this is a difficult question because there is no magic number. It depends on what kind of neuropathy you've had, how long it is, how old the patient is, what their constitution is, what their goals are, your lifestyle, and your current rehab status. But usually when you're there, we can kind of look at the patient and give them kind of a plan and say, we're going to try this many treatments. And if there's been amazing results, we'll know that we've been successful. If there hasn't, we're going to reevaluate and see if we need to carry on.
Jen, question. Are any of acupuncture treatment costs covered by insurance? To the best of your knowledge.
On what insurance companies you have. So generally, the Blue Cross, I believe, for senior citizens does not cover acupuncture, the general one that all senior citizens get. But if you pay for one of the tiers and you're actually paying for a little extra, then it can cover acupuncture. And then plan by plan, it's different. So Sun Life, Green Shield, every plan is totally different, but a lot of them do cover acupuncture. So if you have an insurance plan, it is definitely worth looking into to see if they do cover acupuncture. A lot do.
Okay, thank you.
Yeah. And we'll go to the next slide here, Heather. Chinese medicines for lifestyle and diet therapy for neuropathy. So with lifestyle, we try and get people to minimize stress and do some self-care activities at home. And even like meditation type of activities. It depends on what kind of neuropathy you have of what we suggest. Exercise that is really easy and gentle on the body can be really great for people where you're not doing heavy weights, you're not powerlifting or trying to run a marathon or change the world, but where you're moving the blood flow, getting stuff going. So Tai Chi and Qigong are examples of weightless exercises where you're moving all your joints in different directions and using breathing. Gentle stretching, walking, and yoga are some of the things that, depending on what you have going on, we can recommend. And then diet. Again, diet we could talk about for hours, I'm sure. But common things that we recommend, depending on your situation, would be less inflammatory and processed foods. But again, your situation is different person by person. And then we can recommend things like herbs or herbal teas, but we, again, tailor it specifically to each patient and what your pattern looks like. So the whole Chinese medicine idea is that because we're tailoring it to each person's specific pattern that we have diagnosed, that even taking things like cannabis, we look at it in the Chinese pattern. And so if I'm going to give an example of that. So if you are the menopausal woman who is having neuropathy and you are having hot flashes, you're irritable, you have insomnia issues, and you're taking cannabis maybe for some neuropathy stuff or for some insomnia, if you are actually smoking the cannabis, it is actually adding in Chinese medicine to your problem. And it's actually probably making it a little worse, where if you were to ingest it, it's a different route into your body and that creates less heat, which irritates your Chinese condition a little bit less. So we can also direct you on how to take things properly for your condition based on your diagnosis. So after we've diagnosed you, we can kind of give some suggestions of how to make things more effective for you. Heather, did you want to add anything to that?
Yeah, and I just think that's another important piece, right? Because like sometimes like it can get confusing, right? Like like you hear turmeric's good for anti-inflammatory, right? Like it's good for taking down inflammation. But for some people, from a Chinese medicine standpoint, like we actually wouldn't recommend that. And it can cause more heat and maybe make the condition worse. So, and this is what I think what separates Chinese medicine a little bit like outside and differentiates us is it's really tailored to your specific needs and what's going on with you and what's going on with your health. And another neat thing about Chinese medicine is because of our diagnostic tools, Jen, you mentioned pulse a little bit there, but also the tongue, we can, we can really not only monitor your symptoms, but monitor your condition. You're going to see changes in your tongue that are going to reflect that health and how it's getting better. And we can give you a little bit of education around that, and you can actually physically see the difference. This is different than maybe like, going and getting blood work or having like MRIs or scans done, things like that, nerve conduction studies, right? Because this is stuff that you can do and you can see and you can, see when it's making a difference, right? Not only feel, obviously, but you can like monitor some of these things on your own. So I feel like it does give you a little bit more independence and control over your own health too, Mhm.
Now, Heather, just to expand on that, someone in the audience is asking if Chinese meditation helps. Can you talk about that?
Yeah, for sure I can. Yeah. Chinese meditation. Well, I would say, we can get into things here a little bit because we can start talking about qi and moving qi and I would say, it's becoming very popular these days. Like we talk about meditation a lot, but also like even like I remember in the presentation when we met actually, Linda, you talking about some like morning kind of affirmations, right? We talked about that a little bit and kind of putting out that positive energy. Well, in Chinese medicine, that would be more like a qi, right? And talking about the energy of that qi, the movement of that. And I would say these are definitely foundational principles in Chinese medicine. And so, yeah, I would say anything that you can do here, yeah, is going to be great. But again, coming back to that, it's important to kind of like know that person's condition, and we can really kind of tailor some of those things specific to their needs. But I would say blanket kind of statement, meditation is going to be a benefit for sure. Mm-hmm.
Thank you.
Yeah. I didn't realize there was a Chinese meditation. I always think of it as more India, what is it? Ayurveda, the Indian medicine kind of space. And
well,
sorry, I was going to ask you a philosophical question later. For me, I take bits from each, right? I use some Western, I use some Chinese, I use some Indian stuff, and then some stuff I just make up on my own. But is there any kind of movement anywhere to look at the best, or combining different pieces from all the different places and putting them together?
I think that's a great question. I would say I don't know of anything specifically, but I would say even as a Chinese medicine practitioner, I do some of the same as well. We look at lots of different things, and I don't think that necessarily one thing is the answer all the time. And I do think that there's sometimes like a timing aspect, right? Like sometimes maybe the physiotherapist that you're seeing and you really connect with is the treatment that's needed at that time and works really well for you. But then, as life goes on and different circumstances come up, maybe then it's a massage therapist, or maybe then it's the Chinese medicine practitioner. I think different things work, at different times for each individual. And I think it's really important to kind of find what works with you, what resonates with you. And yeah, what's of benefit? Yeah. Jen, do you have anything to add there? What would you say to that?
Yeah, I feel like I don't know of any one-stop shop for kind of all different kinds of stuff put together, but I know that Qigong, for example, is breathing and stretching the organs in Chinese medicine and movement together. And there's lots of sites where you can specifically say, if you're diagnosed in Chinese medicine with liver problems, there's liver Qigong. So you can actually work on that specifically. But I don't know anywhere that has like Tai Chi, Qigong, meditation, yoga, everything all specific for neuropathy. But whatever you're doing, often there are people who kind of like can guide you and say, you know what, because you have neuropathy, here's some good stretches, or here's some better things to keep focusing on working through. But yeah, it would be great if there was a one-stop shop where it was just focused for neuropathy specifically.
You know what? Yeah, well, focused on neuropathy, that's sort of our dream. But I just dawned on me, a place like here in Calgary, we have, Sylvia and I spoke there, the cancer folks wellness clinic. And they do that kind of thing where they have exercise and yoga and breathing exercises, but of course they have ties in with the medical system and stuff like that.
Yeah,
I'm trying to think of it. Sylvia, I saw that you were on. If you can think of the name of it, can you pop it in the?
Is it Wellspring?
Wellspring, yes, thank you.
Yeah.
They have their clinic, or I don't know if it's a clinic, but they kind of have a collection of all the things brought together to help people who are specifically going through cancer or after.
There's a very good question for both you, Jen, and Heather. Is your clinic located in Calgary? Well, yes. So in Trinzy, yes, but I don't know about you, Jen. And are you both currently taking new patients?
Yes, we are both in Calgary. I'm at Power Health Chinook, so I'm or not downtown. I'm kind of like central in the city, right by Chinook Mall. Mm-hmm. And Heather, you're at a couple of different places. So I'm gonna let you answer kind of where you're at on your own. I am taking new patients. I am busy though. There is at least a couple of week wait list to get in. but I am still taking new patients.
And you
Heather?
said that's Power Health, correct?
Yeah, I think our information's right here on this slide
Very
here.
good. Thank you so much.
And again, if people, I am often with patients, so I left my office phone number, but if they do want to chat and have conversations, leave a message with the receptionist and I will phone back and we can do a phone consult or have a little chat before, usually at the end of the day though, because I'm back to back with people. And Heather, what about you?
Yeah, so I'm at a few different places. The easiest to probably get into is Intrinsi, where we met there, Linda. So Intrinsi is a multidisciplinary clinic. So there's chiro there, there's physio, there's osteopath, there's acupuncture and massage. So this clinic is located on 17th Ave, downtown, and it's wheelchair accessible too. So if you need, that's probably the easiest place to get into. I'm also at a neurological clinic here in town called Synaptic, which does a lot of like neuro rehab. And again, they have massage therapists, they have kinesiologists, and they have physiotherapists that work a lot with, and acupuncture, that work a lot with neurological conditions. That one's a little trickier to get into. They have like a longer wait list. And it's extensively growing because there's a huge need for this kind of stuff. And that one's just off of McLeod Trail. But I would say if you have questions or you're kind of wondering, yeah, contact either Jen or myself. Our contact info's there. Shoot us an email. This is my personal email, and that's my personal cell. I don't mind taking calls or answering texts. Yeah, we're heading into the holidays. I have a bit of downtime. I'm looking forward to that, but I'm still open to answering questions. So yeah. Yeah, does that kind of help?
Yeah, does anybody have any further questions or how's everyone feeling?
Well, so far.
Okay.
Thanks so much, ladies, for all your time and effort and sharing your information and knowledge with us today. Yeah, it was really, really thoughtful of you and great, generous.
Yeah, we were excited to be a part of it. Thank you for inviting us.
Thanks. And yeah, I'll make sure people can get your information. I'll probably take a snapshot of that and forward it on. I try to follow up with an email afterwards because there's always people who intended to come and then didn't. Hence the half of the people show up. So I'll be forwarding that on to them. Okay, well, thanks everyone for coming out today and hope to see you in the new year. January 4th is our first connections meeting. I think that's right. And then the guest speaker in January, which again, reminder that it's been moved from what, the 17th is it to the 24th. Oh, that's friggin' heck. Is that February? No, I'm thinking something else. Never mind. I'm getting them all confused. Anyway,
Thank you, Heather
it's
and
on the
Jen, for it.
notices.
Sorry. Thank you for a fabulous presentation. I love those DNA slides, those intro slides. They're really sharp looking.
Okay.
Yeah, thanks. I think we were both, well, I think we both kind of fangirl over Chinese medicine and the benefits. And so, you know, it's always a welcome opportunity to kind of talk about this beautiful medicine and what it can do for people, because I love that it's natural. I love that it's easy. You know, in terms of medicine, it's, you know, it's fairly cheap for the most part, right? So yeah, it's just, I can't say enough great things about it. And I know, Jen, you're the same, hey?
Yeah. We feel really honored to be able to just talk about what we do and that we've been a little bit more accepted. Me and Heather have been a little bit in the hospital system lately, working on some interesting spinal cord injuries, and that's been wonderful. So thank you very much.
It's definitely getting more accepted, which is awesome. Yeah. Okay. Bye, everybody.